All right, so T2, airway. First I'm gonna check my BSI. My BSI is intact. Now I'm gonna check my patient's airway. Hey buddy, are you still awake?
Yep, doing good.
All right, since the patient is alert, his airway is still intact. All right, hang on, I'll be right back. Going to my next patient. All right, patient 2. I'm gonna check my BSI, no breaks. I'm now gonna check for airway. Hey, are you awake?
Patient is unconscious.
All right, I'm going to perform a head tilt, chin lift, look, listen, feel.
Airway is not patent.
All right, I'm now going to perform a nasopharyngeal airway. All procedures will be done on the mannequin. So patient's head is in neutral position. I check the nasal passages for any obstructions.
No obstructions.
Fantastic. I am now going to select an appropriate size nasopharyngeal airway from the tip of the nose to the base of the ear. I'm going to apply lubrication. And then you're going to apply it with the bevel toward the septum, pressing until it is in position or definitive resistance is felt. Once it is in position, I'm going to secure it with a piece of tape. And I'm going to try to avoid blocking the other nose or the mouth. At this point, I'm going to reassess the airway.
Airway is not patent.
All right, so since that was ineffective, I'm going to have to move to an eye gel. So, step 1, I'm going to select an appropriate sized eye gel based on my patient's weight and size. I'm now going to take my eye gel, applying lubricant, removing excess lubricant. I make sure my patient's head is in alignment, performing a head tilt chin lift. I am then going to perform a scissor technique to open the mouth, taking the eye gel, placing it firmly toward the back.
Patient's gag reflex is intact.
All right, since the patient's gag reflex is intact, I'm not going to be able to place this intervention. We are now going to move to a crike. Step 1, I'm going to prepare my armamentarium for the crike. If you have a cravat or another thing to lay out, it's good to create a clean surface to work on. But remember, this is not a sterile procedure. All right, I'm going to need a crike hook. I'm going to need a scalpel. I'm going to need my crike tube and a 10 milliliter syringe. I'll attach that now, pre-inflated to the full 10 milliliters. I'm also going to need to make sure that I have my bag valve handy and my stethoscope. Then I'm going to take an alcohol wipe. Now that I have prepared my armamentarium, I am going to first identify the location. Now that I've identified it, I'm going to wipe with my alcohol wipe. With my non-dominant hand, I'm going to stabilize the throat, re-identifying the location with my index finger. I am now going to take my scalpel, and I'm going to make a 1-inch vertical incision through the skin. I now reconfirm the site of the hyoid membrane and make a, with my index finger, and then I'm going to make a 1/2-inch horizontal incision. I will now take my hook, place it to elevate the cartilage. Once that is elevated, I'm going to place my tube down toward the lung. I release the hook before I inflate. I'm going to now inflate. Fantastic. Now I'm going to make sure that my tube is appropriately in place by placing the bag valve and listening in both lung fields. Do I have air sounds in both lung fields?
Yes.
All right, and now I'm going to take my pulse oximeter, put it on the patient's finger, and then I am going to count for 10 seconds to see how many breaths happen. 1, 2, 10.
2 breaths.
Since there are 2 breaths in 10 seconds, that means he is breathing between 8 and 30 breaths, and he is not going to require manual ventilation at this time. Now that that is in place, I am going to bandage the site with a small piece of gauze, and then I'm going to secure by placing the neck around. There's often a small little clasp here that you can attach to. You can also use tape if the need requires. Once we're secured, we are going to move to our next patient. Wait, we're going to move to patient 3. Step 1, BSI. All right, hey patient, are you still awake?
I am, sir.
Fantastic. Patient is awake, his airway is patent. We are now going to move to patient 1 for respirations.